Okay. Perfect. Okay, so it is now being recorded.
Cool. Good morning, everybody, and I hope you're all doing well and having a wonderful day. Here with Ms. Sandra Celedon. She's a Fresno advocate that I have the fortune to spend some time with this morning to talk about issues that affect our communities. I know a lot of you have heard me speak on systemic racism and environmental justice, but I'm kind of new to this, and I know that Sandra has a lot more experience advocating and a lot more lessons learned than I have, and that I've seen, a lot of folks here in Sacramento who are just getting started, that maybe they could learn from those. And so, without further ado, I'd like to welcome you, Sandra, and thank you so much for taking the time to have this conversation. And with that, I'll let you introduce yourself.
Yes, good morning, Jose. Really happy to be here with you. And as you mentioned, my name is Sandra Celedon. I work with Fresno Building Healthy Communities and in the city of Fresno and Fresno County in the Central Valley. And my work really for the last close to 15 years now has really been focused on how do we improve our communities? How do we make sure that we have the resources that we all need to achieve success and in whatever ways that folks define that? And ultimately, how do we make sure that we're able to live and thrive in the Central Valley in the state of California and by extension in the U.S. and while all at the same time while ensuring that we protect natural resources and that we take care of the earth so that our kids and their kids and the generations after us are able to also live in a society and in a world that nurtures their growth and their well-being.
And thank you. So, given your work and the commitment you have to communities, I wanted to ask if there was like one galvanizing issue that brought you into this work.
Yeah, I don't know that I would say that there's like one galvanizing issue. I will say that um, I think I fell into the work of community organizing and public health definitely based on my personal experiences. And so, I share with folks all the time that I'm an immigrant. I was born in Mexico and I moved to the Central Valley, to a small unincorporated community in the Central Valley by the name of Kawa. When I was 6 years old, and I lived in this community, and it helped raise me, for the next 30 plus years of my life. And so I grew up not really understanding, right, like the ways that that society has created or tried to create a box for me and other people who look like me, not only as a immigrant, but also as a Latina, as a woman, as somebody who comes from humble background. And so I will say that for me, definitely a couple of things kind of connected was one, when I was a teenager, my dad had a massive aneurysm when I was a senior in high school. And, healthy guy by any other standards. And that was really kind of my first interaction with the medical system in a way that I felt was really designed to not actually care for people like my dad, right? And not actually provide the level of care and the level of service that people like my dad really deserve, like all of us, any of us, by just the nature of the fact that we should be treated with dignity and that our lives should be valued. And so that really kind of forced me to become an advocate for my family. And I spent, a lot of the time that my dad was hospitalized, just understanding kind of how hospitals work, how healthcare in this country works or doesn't work for people. And then that really coupled with me going to starting college at Fresno State. And, again, being somebody from a humble background, having to take the bus, right? Having to take the bus to get to the university in Fresno, which really translated into a 45-minute daily one-way trip. And that gave me a lot of time to look out the window and notice that not all children actually live with a train switching yard in their backyard, right? That not all people live in neighborhoods where it floods, the streets flood when it rains, or where there is, bus stops are in the middle of a muddy dirt field, or that, actually, you're not supposed to get these smells in the air. And so it was through kind of that bus ride that ultimately took me from South Fresno all the way up to North Fresno, that I got to really experience the differences and notice the differences between where I grew up and where others were growing up. And it was really in college, I think I'll say it was my second semester in freshman year, where I took a public health course as an option, as an elective. It was a community health class that really spoke about how the environment that you grow up in, the physical environment, actually determines not just your health, but the types of opportunities that will or will not be available to you. And so to me, that kind of clicked, right? Just going through that experience with my dad, remembering, right, how I grew up in this beautiful community of Kawa, but also seeing how others grew up with the things that they need, like a library nearby, or trees that help clean their air, parks, right, or housing, sidewalks, street lights, with air that doesn't hurt when you breathe, with not even having to think about how you're going to get to, right, the university, or how you're going to pay for it, or how do you make sure that your dad isn't tossed aside by the medical system, and that is actually provided with the care to be able to recover. And so all of these things for me kind of really clicked that second semester of my freshman year, because I was able to connect what I was learning with what I knew, right? And so that really, for me, was a pivotal point in time where I changed my major, right? I thought at that point that I wanted to become a nurse. Nurses are great, right? But I really understood that, actually, I don't want to take care of sick people. I want to prevent people from getting sick. And so that really changed my trajectory. I became a public health major that second semester. And then I, never looked back. And I've done all of the advocacy and organizing work that I do is really from that public health lens about how do we create the conditions necessary so that people are able then to thrive, right? As opposed to how do we teach people how to navigate a system that's broken? It's actually how do we dismantle that system and make it work for people?
Yeah, right on. I think that kind of got to the earlier galvanizing thing, like what kind of brought you to this. And um, I think it's wonderful that you went to school because you saw these things, and then you came back and gave back what you learned to your community. I think that's the ideal, to be able to do that. I'm an immigrant also, and I think we're from the same region. You mentioned Guanajuato. I'm from La Piedad. We crossed the puente, and we're in Santana, Penjamo, and so my family was from Penjamo as well. Um, and I also see how immigrant communities um, are disfavored in land use decisions, but tokenized as well, um, when when it's necessary. I've seen government do that. Um, so after 15 years, can you share some like highlights, some moments that have made you the happiest, as well as some of the like more frustrating obstacles?
Yeah, I'll say, I think I've been really lucky, one, to build relationships, right? What I call like authentic, genuine relationships with people in my community, right? People that I care about and that I know care about me. And so I think that there's a couple of instances where I will say like some of my proudest moments in terms of one, in early 2020, I was able to help as a collective secure a grant for Cowell Park to renovate Cowell Park. So we got a $6.6 million grant from the state through the state parks department to renovate Cowell Park in my neighborhood. And so to me, that was like absolutely like the cherry on top of bringing real dollars back into my barrio, right? To like help fix a park that I grew up in, that many folks, right, is like the only kind of green space in my neighborhood. So that was definitely something that I'm really excited about, that we're still working through to implement, that, hopefully by the end of that project, we're gonna renovate this existing park into a park that people deserve to be able to grow up in. So I was really excited about that, in terms of just very like, again, how do you bring it back home, right? But there's definitely a couple of other things that I think are really important. I mentioned about my experience with my dad, being an immigrant, being a warehouse worker, and not having insurance, and just the challenges that our family had to go through to make sure that he was taken care of after his aneurysm. And so that really, again, cemented for me the need to make sure that all people have access to healthcare, regardless of who they are, where they come from, what they look like, and where they live. And so one of the other kind of pivotal points I think will be, prior to kind of doing work in community organizing, I was working for a federally qualified healthcare system, right? And helping to build programs that enable people to have access to care, right? Not insurance, but like actual medical care. And so that was, that was absolutely like life-giving for me as well, and being able to shape programs in a way that really meets the needs of people. But ultimately, what did help was that by 2015, as part of, again, a group of many, we were able to change, to advance a program in Fresno County, called the Non-Resident Specialty Fund, which it's a $5.5 million annual fund that enables people who are undocumented, uninsured, and low income to access specialty care in Fresno County, to make sure that they're able to, go and see a specialist when they need to. So that was another point that for me was a success, right? And like getting a county that's pretty conservative, right? That's led by, predominantly old white men, to actually implement a program that benefits folks that in the past have not been viewed as valued. To me was, something that I will carry as a win, and that I think that really helped add to the statewide advocacy around expansion of Medi-Cal for folks that are undocumented, right? And so that's where we see today, is where we know now that, teenagers and young adults that are undocumented are able to access Medi-Cal, right? This year, we know that our elders, right, folks that are over 50, will be able to sign up for Medi-Cal, and then in turn, hopefully, we'll be able to access health care, right, which is ultimately what's important here. And so we're chipping away at creating access to health care for all Californians. And I think that in itself is powerful, because I think California will help bring the country along, right, to achieve, access to, at least to start chipping away at ultimately making sure that everyone has access to healthcare. So I'll say those are some of the places where I've been really proud, because it kind of makes things real for me, right? One is there's going to be a physical park that kids are going to be able to like touch and play in, right? And then there's also, right, like people are able to get like actual health care, right, to meet their individual needs. So I think those two things for me have been some of the proudest, that kind of, again, take it back home, either in regards to my neighborhood or my family, right? And that ultimately I want my family to be okay. And that also translates into I want my community to be okay. And I want, right, all of my people to be okay. And that we have to, like, again, make it real for folks. And so how do we make that real? And I think those are two examples where I feel like I probably have contributed the most.
Yeah, that's great. And I know you're too humble to ask, but I hope they name it Sandra Celedon Park. And regarding the healthcare, um, something else I've heard, and I think it might have been an issue in Kawa as well. If even having Medi-Cal, Medicare, do folks have access to facilities locally, or would they have to travel kind of far to see a doctor?
Yeah, so that's the other piece of the kind of the equation, right? And that's what I meant about, it's not just about health insurance, right? It's about like actual care. And so that is a big challenge, right? So right now in Kawa, right, there isn't a healthcare provider, right? So they would have to go and seek one somewhere else. And so I do think, again, like this is where it's starting to chip away at this model that healthcare is based on capitalism, right? Like we have to actually start to undo that. And so I understand like expanding Medi-Cal is one way that we kind of get closer to a single payer model, right? And at the same time, like we need to be changing like the actual delivery system. How do people actually get healthcare? But and then I think then the question is not only do we need to invest in creating like training more providers, right? And I think that that also goes into account of like nurses, right? I mentioned earlier that in the beginning when I started college, I wanted to become a nurse, and part of that was a reflection of the people who cared for my dad, right? Like the ones that I felt like were actually provided the most care that got it were the nurses. And so I think that we need to be investing in like how do we like make sure that folks are able to become nurses, right? More folks are able to become nurses, not just doctors and practitioners, but also like medical assistants, right? But and I think the other piece is also like we've been doing a lot of work right now on COVID, prevention. How do we also like take the strength of our community and like the fact that we have um healers in our community, right? Either like that are sobadores, curanderos, right? If you're in the Latino community or if you're in the Mon community, shamans, right? Like all of like our different cultures have different versions of healers. And I think we also got to acknowledge that like that's also a form of care because ultimately the goal is wellness, right? And so I think part of for me has been how do we create like how do we take what we already have in our community that we know is like health inducing and wellness inducing and invest in more of that, right? And start to undo the systems that we know are not working, right? And so we know that if we just focus on providing people with insurance, that's not going to get people health care, right? Because we have to make sure that we also have the providers that we need. And so I think like it's both and, right? So we've been working also on how do we like invest in supporting young people and other folks to become right the next generation of providers, but that provide healthcare in a way that speaks to me, right? That takes into account who I am. And so I think that's the piece of the kind of the broader work that we're doing around one, how do we make sure that people live in a neighborhood that isn't polluting their air, right? How do we make sure that people have jobs that enable them to like have access to a healthy home, whether that's renting or buying a home, but that their home is in a condition that promotes their well-being? How do we make sure people go to schools that and the school is getting them ready to like be critical thinkers and like explore different things, right? I would have never gone into public health if I didn't get an opportunity to explore right different electives. So how do we make sure that more people have that kind of access? And then of course, like how do we make sure people have access to actual health care? But all of those things have to be true, right? Because otherwise, if we only give one or the other, then people are still not going to be able to achieve wellness. And that's ultimately the goal, right? Because we're all well-rounded, right? People that have different needs that, you're not just one kind of track person, right? We all have different needs. And so it's really more thinking about how do we structure society in a way that enables us to have our basic needs met and then provides us opportunity to then, right, really explore happiness and wellness. And I think that's been like the work that I've been kind of slowly peeling away at with many others around how do we create what our name is. How do we build a healthy community? Because it doesn't just happen, right? Like we have to be intentional about it. And I think that's the same approach that we take in terms of, okay, how do we build a health system that's intentional, right? That's intentional and that actually results in people being healthy. How do we build a community that's intentional, that actually results in people like thriving in a neighborhood? And how do we build an education system that's intentional, that doesn't put people into a box, but that actually allows them to explore their creativity and their skills and gain new talents? Because none of us are born with it, right? Like you can actually explore different things that you never thought were possible, but you can't do that if you're feeling sick, and you can't do that if you're poor, and you can't do that, right? Like all of these kind of other barriers that are created by society, like we create these, and so that means that we can undo them too.
Yeah. Can you excuse me for like 2 seconds?
Yeah.
My dog's scratching the door. Sorry. Don't go out there and bark. Sorry about that. Yeah, I like what you said about the holistic approach because, oftentimes what I see is silos amongst people that want to do well.
Right.
And, I kind of got like a beef with government and how they've done stuff. And I think I've seen, when folks are siloed, they can say that they've been treated right and done well while ignoring other places where that's not happening.
Right.
They might build a resource center in a disadvantaged community, um, but at the same time they're putting polluting industries there, and they're getting kudos for that resource center.
Right.
Pass on the pollution. Um, yeah, I mean, there's so much conversations that could happen off just what you said. To kind of put in some humor, I would say that one time I had these really bad pains, and my mom, like, I couldn't move, and my mom gave me like a couple pennies, a nickel, and a quarter, and said, "Go across the street and ask that señora for a little bit of ruda." And I drank it, and the pain went away like almost instantly. And we joke about a soda and vapor rub fixes everything, but when I was always at my worst with a cold, my mom would give me a planchada.
Right.
And that always worked. Like the next day I was cured. And so um I think with that proactiveness, like you kind of do need to have those relationships with the community where you're checking up on each other and everybody's looking out. And um and then again, as far as the holistic, uh I grew up in a really poor neighborhood, and there's been times when I've been depressed.
Mm-hmm.
And I walk out my house looking for a reason to have hope. And I see a lot of people that are broken going to the liquor store. I see a lot of garbage in my community that hasn't been picked up. And a lot of that is, the government just neglecting that community because they would have picked it up quickly in another place.
Right.
So then we look like we're dirty, and that helped shape the self image that I had. And so I do think that it's great that you guys are looking at it holistically, because sometimes I feel like enough people don't, and
Right.
that gives government passes in other places. And so with that, you mentioned some of your accomplishments, and I remember one was a bigger grant and for transformative climate communities that you were a part of. And if I recall, you guys had gotten the grant, and then there was an effort to spend the money somewhere other than the community that was designated for that grant. And so I also recall hearing that, Randall from the Strategic Growth Council, a governmental person, was a big friend to the community. And would you mind sharing a little bit about, working with them, the Board of Supervisors, and
Yeah. I'll start by saying, right, Jose, that work, it didn't start with the Transformative Climate Communities program. So I'll reel it back, and I think this is part of like a really good example of why it's really important to do long-term work, right? Because any community organizing work, that if you're going to be successful at it, you have to be in it for the long haul, right? Because we know that real change doesn't happen overnight, right? That we're actually like up against a system that has enabled, right, like all of these inequities to happen since the beginning of this country, right, and even before that. And so I think for us, in Fresno, part of what was happening at that time is that we had been doing a lot of work around our general plan, right, which is a document that all jurisdictions have to do, all cities have to do, that really looks at, it's supposed to look at their current population and then their projected population growth, right? To say, okay, in the next 20 years, how many people do we anticipate are going to live in your city? And then based on that number of people, how are you going to meet those people's needs, right? How are you going to make sure that there's enough housing, jobs, parks, community centers, right? Areas where small business and business can happen, kind of all of these things that make up a community. And so the general plan kind of helps set the big policies for, that city or that locality. And then other plans follow, right, based on that kind of umbrella. And so those are community specific plans. Um, and so for us in Fresno, we had been working on the general plan, right, for a number of years, because traditionally those plans come around every 10 years, right? So they're looking 20 years forward, but they start to renew them kind of at the 10-year mark, right? Because it usually takes a couple of years, if not more. So for us, we had been in that kind of conversation for, at that point, about 5, 6 years. And it was new for Fresno in the sense that historically, like in many communities, most everyday community members don't get involved in the general plan, right? Because it's policy, it's like land use language, that kind of stuff. And so traditionally, it's a negotiation between politicians and developers. And they're basically, carving up your community is really what's happening. And so for us, we had been organizing for quite some time, and we kept hearing about kind of what people really cared about, and which they still do, right? Which is housing. How do I make sure that I have access to a house that I can afford, right? Or a place that I can live and afford, that is healthy, right? That meets my needs. How do I make sure that, I have sidewalks, and that there's dog control, and there's street lighting and bike lanes and parks, and right, all of these things that we know people need and desire. And then of course, we do a lot of our organizing in South Fresno. And so for Fresno, our community split between North and South, right? So South is going to be predominantly Latinos, Black, Southeast Asian folks, right, that are live in neighborhoods that have been underinvested, that are low opportunity neighborhoods, right? And in North Fresno, it's going to be the opposite. You're going to have mostly white folks that live there, that are folks that are living in communities that are either newer, because they're newer developments, or are communities where there's a lot of investment that has happened over time, right? And so you have the haves and have-nots. And in most communities and most, large cities across the country, there's some type of split, right? It may be east and west, north or south, right? Like there is, but I bet you, like, everybody knows where where that is, right, in your neighborhood. So it's the same for Fresno. And so we kept hearing from folks as we were engaging about, hey, we want to get all these needs addressed. And so we were thinking about, okay, well, what's the best way where we make the biggest impact, right, to change and to really kind of essentially set the rules, change the rules of how things happen in our community. And that was the engagement that we had with the general plan about, what, the general plan is up for renewal. We need to make sure that we are engaging in that general plan update, and that we're making sure that we're and helping to inform how those policies are being developed, because that's going to lay the groundwork for future investments, right? And so that was how we started with the general plan work. So from that work, then we said, okay, we're going to get engaged in the community specific plans that we care about. So that's the Southwest specific plan, the Southeast specific plan, and the South Central specific plan, because this is where our gente is, right? So this is where we have the most relationships. We also know these are the neighborhoods that have been underinvested, where resources have been reallocated to other parts of the city. And these are also where, we know that has the highest needs, right? And so we engaged in the Southwest specific plan. And so we were engaging community on that, right? Making sure that, like, they were following along in the process, that they were, participating in that process. And it was one of the things that was historic for Fresno, was that this was the first time in our history that we actually had a Southwest specific plan, right? Because in the past, this is our neighborhood where historically it has been redlined, meaning that only Black folks were allowed to live in Southwest Fresno for a long time, because that was the only place where they could buy homes, right? And then of course, like Chinese Americans, and of course Mexicanos, right, and other Latinos. So this was kind of, used as the neighborhood where, like, the folks that, that were being, insert group that's being discriminated against today, right? And that's where we're gonna kind of push those folks. And so, kind of racism follows a pattern, right? Which is, this is the neighborhood where we put the most heavy industrial uses, meaning all of the companies that pollute the most, warehouses, right, refineries, meat rendering plants, you name it. That's the area where they're located, right? Because the city said, that's where we want you guys to be. And then of course, this is also the neighborhoods where there hasn't been any investment in, like, infrastructure, like sidewalks or streetlights, or like paved roads or trails or parks, right? And so we said, okay, we really want to engage in the Southwest specific plan to come up with, like, now you're refining more specific policies that are going to be about, okay, what kinds of housing are we going to build, where, right? And who's going to do what kind of public institutions are we going to build, and all of the kind of those ideas. But we also said we want to make it real, right? We don't want to make it a plan that just kind of, okay, it's a wish, right? We wish these things happen. And so we said, how do we actually like create money, right? Generate money to make some of these things happen. And so it was then that we started looking at the state, right? Because the state was kind of pursuing this cap and trade model around, we let people pollute in some other parts and then they pay some money and then we have a pot of money and then we'll use that money to make other parts better, right? Which is not a perfect system. It is not a system that, that's not the answer long term. But we said, okay, let's try to leverage some dollars at least. And so through one of our partner organizations, Leadership Council for Justice and Accountability, and our statewide partners, we actually started crafting the legislation that helped create the Transformative Climate Communities program, right? Because the idea was, how do we reduce pollution and increase public health and spur economic development in neighborhoods that are identified as the most polluted in the entire state of California? And we said, well, that's easy. Southwest Fresno is the #1 most polluted community across the state of California based on the state's own metrics, right? What they call the Cal screening tool. So we said, based just on your data points that you're looking at, this is the census tract that's like the worst of the worst across the state. So we really need to make sure that we fund that, right? That we fund projects in this neighborhood. And so locally, we were working on that Southwest specific plan, right? And so, of course, the way that the story always goes, Jose, is the politicians were like, oh, okay, well, we're going to use your demographics to say, okay, so this neighborhood is the most, concentrated poverty, the most brown and black, and it's also the most polluted. So we're going to use that to write this policy. So the bill passes, the Transformative Climate Communities program gets implemented. And they said, but then the guidelines, right? So we're going to use kind of the story of, right, Black and brown and Southeast Asian people are being, over polluted and are dying, right, at 52, and are, and need economic investment. But then we're going to write the guidelines to make sure that the money only goes to the neighborhoods where we want, to go. And at that time, what was happening was the local politicians wanted the money, which is the $70 million, right, that was set aside through the Transformative Climate Communities program for Fresno, right, that we said we really want to use this to leverage the implementation of the Southwest Specific Plan. They said, well, actually, we want that money to go into downtown Fresno because this is the neighborhood where they've been actively gentrifying, right, calling it revitalizing. And they're like, we really want that money to go to downtown to help kind of build out the housing and parks and the kind of bike lane and infrastructure to allow the high-speed rail station, downtown station, to actually happen in the future. And so what they're thinking about is not the people who are already there. They're thinking about the people who are going to be there as they gentrify, right? And so that really became the fight to say, no, 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 that's not what these dollars are for, right? Like, these dollars are to make the lives of the people who already live in these communities better, right? And we had already identified specific things that community really wanted through the Southwest Specific Plan. And one of those was, this is a community where we haven't had a higher education institution ever, right? And in fact, it was only in like the early 2000s that they got their first middle school, right? And so the community had already identified having a community college, right, located in Southwest Fresno, in a specific area of Southwest, along with, creating more trails to allow people to bike and walk, right, to create connectivity, right, adding more affordable housing in their neighborhoods, right? So kind of a number of these kind of projects and things that people wanted. And so what we really started to do was we had to organize essentially against our local politicians and say, nope, this money really, right, the guidelines really need to make sure that the money gets to its intended neighborhoods, right? Which is, if this is about reducing pollution, creating public health, and creating economic mobility, then there's no way that this money can go anywhere else except Southwest Fresno, right? If we're like thinking about those metrics. And so what happened was, at that time, right, it was the Strategic Growth Council that was making the decisions around the guidelines. And so what we did is we started to reach out to the Strategic Growth Council to say, look, we want you to understand that the narrative that's being pushed out by politicians is not actually the narrative that communities is advancing, right? So we want you to talk to community. And in fact, we organized taking community members from Fresno up to Sacramento to the Strategic Growth Council hearing so that the community members themselves would share it directly, right? So we said, don't even hear from us, like hear from people who live there, right? And so we started enabling folks to come out to Sacramento if they chose to. But then what we did with Randall at that time, he was the executive director for the Strategic Growth Council. We said, come to our neighborhood, come and meet the neighbors that we're organizing with, come and see the neighborhoods that we're talking about. And so we invited him along with I think it was Ken, who's the chair at the time of the Strategic Growth Council, and said, come down to Fresno. And so they both did it at different times. But with Randall, it was really when he came to Fresno, we gave him a community tour. And we didn't do a kind of what I call a poverty tour of let me show you how poor we are, but it was more of a community tour of let me show you where our community has been planning and what they're talking about in the vision, right? And so we actually took him, to different places of the neighborhood, but we took him specifically to the big empty lot that we said, this is the lot the community has identified where a future community college could go. And then the rest of the lots would be developed for housing and a park. And then we could connect transportation. And so people could live right in a neighborhood where they could go to college, right? Where they could go and have free play through a park, where they could get on a bus and go downtown or go to other places across our city, right? But this is what community's talking about. And it was the first time that he kind of clicked, oh, this is where education, right, and transformation can meet. Because not only will we empower communities by providing educational opportunities, but we can create programs that will advance, right, climate adaptation and climate justice. We can actually create housing that enables people to achieve home ownership, right? We can actually improve the air quality in this neighborhood by planting trees and creating a connected trail network. So he then got the vision, right, which is what community has been planning and plotting for at that point over a decade. And so I think that was a pivotal point where Rando understood what we were talking about. And that really kind of helped cement the guidelines in a way that we were able to essentially beat the politicians and expand the guidelines so that the dollars would actually reach Southwest Fresno. And so ultimately, in the end, for the Transformative Climate Communities investment that we were able to leverage the 70 million, 35 of that million is going towards projects in Southwest Fresno that were envisioned in the Southwest Pacific Plan, that were driven by community, that were written by community, that were led by community. And then also projects into Chinatown, which is our historic neighborhood where Chinese folks were relegated when they were the new immigrants in our community. And then some of those dollars did reach into downtown, right? But again, we were able to really think about how do we invest in downtown for the people who already live downtown, which are predominantly, again, people of color, not necessarily how do we make white people feel safe about coming downtown, right? And so I think that was really transformational because it was one of the first times where community members were able to really take a project from start, write the policy, write the vision, leverage the dollars, and then push back against politicians who were then hey, now that you guys got the dollars, we'll use them however we want. And that, we didn't allow that to happen. But I think it was as a result of we had been doing organizing around that specific issue for the last 10 years already.
Wow. Thank you so much for sharing that. I think, as mentioned, that Facebook platform, it's EJ California. And so part of the goal with that is to share lessons, that folks all over can hear. And I think what you shared is fairly typical of government, and even here, I grew up in this community where I lived in three communities: the housing projects, and then Oak Park in Sacramento, which was known as the worst community at the time, and now South Sac, which is known as the worst community in Sacramento. And um, in Oak Park, there was a time where I could stand on the corner and for 15 minutes not see anybody but a person of color. And I can stand on that same corner now and not see a person of color for 15 minutes on a thriving street with $800 million townhomes. And to this day, I still hear that community being talked about in terms of food deserts. And there's nobody left there that would qualify for the description of a food desert. It's using that pain and suffering to accelerate the gentrification of this community.
Right.
And a lot of the times, one of my struggles is that a lot of advocates are over there because that's how they can keep organization building. And at the same time, there's communities where, while this community is being gentrified, a lot of folks are being pushed to this other community and no one's speaking up for that community. And, also with funds, I know that here, we got some COVID funding and that's being used to build homeless housing in a disadvantaged community. And, when one thinks of COVID, our communities, Black, Brown, especially Fresno, were hit the hardest.
Right.
And it's, people aren't pollution, but it does seem that like homeless shelters are being cited almost exclusively in Black and Brown communities.
Right.
And do you see that as an EJ issue?
Absolutely. I think that it ultimately becomes, environmental justice is really like racial justice, right? Because they go hand in hand together. And I think, talking about redlining and the fact that this is a historical practice in the United States of America, right? Which all communities have a neighborhood or an area that has been redlined, which means, I mean, literally the term comes from, back in the day, bankers, right, would literally draw red lines on maps to say, we're not going to give anybody a loan to purchase a home, right, in these areas because and only certain people can live in those neighborhoods, right? And historically it's been Black, right, and other people of color. And so I think like we're still seeing that specifically with homeless folks, right? And that communities, cities, and jurisdictions are redlining where homeless people can be, right? There isn't the conversation around what is the number one cause of homelessness. People will try to attribute homelessness to like personal failure, right? But that's really not the number one reason that people are homeless. The number one reason that people end up homeless is because of lack of affordable homes, right? So people cannot afford to live right in a home, whether that's an apartment or a house, right? Whatever, kind of structure that is, the fact of the matter is that we're not creating a society where the everyday person can afford to have a roof over their heads. That's the number one reason people end up homeless, bottom line. Of course, you can add other, right? Because again, nothing is like, obsolete. There are other right challenges that we all face as a society. That's mental health, substance use, right? But all of those kind of precursors to homelessness can be addressed with good policy and sound investment. But one of the challenges, and I think this is where it gets into not in my backyard, right? Like the NIMBY folks is the acronym for not in my backyard, is that as a society, like we've created this false sense of like security that as long as it's not happening in my neighborhood or in my backyard, I don't have to worry about it. And the fact of the matter is that if we continue to like just push people that are experiencing homelessness into neighborhoods where there is no opportunity, the likelihood that they'll ever be able to like get out of homelessness, right, and become like housed is pretty like slim. And that's the truth with, even if it's just like, let's say you're not a person that's homeless, if you're a person that's poor, if you get forced to continuously live in a neighborhood that doesn't allow for opportunity to come out of poverty, you're never going to like stop being poor, right? No matter how hard you work, because this whole analogy of like, if you work hard, you'll get ahead in life cannot be further from the truth. Because how many of us know hardworking people that are still poor, that don't have access to health care, right? I mean, COVID has demonstrated that, right? Who are like the hardest working people during COVID? All of our essential workers, right? That we've deemed essential. Folks that work in, farm and out in the fields, in the warehouses and distribution centers, at the grocery store, at the carniceria, all of the folks that we were like, please don't stop working so that I can get my needs met. We call them essential. Those are the same people that can't get out of poverty. And they can't get out of poverty because we don't create opportunities for them to get out of poverty. So that's exactly the same thing with people that are experiencing homelessness, right? They're not going to be able to get out of that situation, right? Because we're not creating the ability for them to be able to be permanently housed, right? And so this is where I think, like for us, one of the things that we've been pushing at the local and state level is inclusionary zoning, right? Which means we need to be able to zone for different income brackets in one neighborhood. So in your neighborhood, you should not all be poor, right? You should have in your neighborhood people who, are considered middle class. You should have in your neighborhood people who are considered working class. You should have people in your neighborhood that are considered, poor because they're earning below the poverty threshold guidelines. And you should have people in your neighborhood who are currently experiencing homelessness. And the idea of having kind of this inclusionary type of structure is that then you're going to invest in your neighborhood, right? Because in your neighborhood, then that person that is in either transitional housing or in a shelter that is considered homeless, they should be able to have some level of stability that then they can start to work their way out of homelessness, right? The people that are considered that are, living in poverty, they should have access to opportunity in that neighborhood to be able to like either move into another job sector or go into a training program or pursue higher education, right? To come out of poverty. The people that are considered working class, they should have the opportunity to work into the middle class and so forth and so on. That's what we're calling like, building a ladder. But right now, the thing is that, and the way that our society is structured is once I get on that ladder, it is my instinct to go back and pick up the ladder. So nobody behind me can climb that ladder. And that is like the selfishness that is hurting our community, right? And it's showing up in the way that we make public investments. And so the idea here is we have to make public investments because that's all of our dollars. We all pay for them. I don't care who you are, whether you're documented, undocumented, right? If you pay and purchase anything, right, in this society, somehow you're contributing to our collective pot of money. And it's that collective pot of money that we should be investing in ways that create opportunity for all of us. And some of us maybe like all we want to, and I think this is the truth for most people. Most of us just want to be able to have a, good enough job that pays as well so that I can pay my bills, that I don't have to worry about, being homeless, and that maybe every once in a while I can do something nice for myself or my family. That's what most people want, right? Most of us are not actually trying to, become rich, right? And if you are, okay, go for it. There should be opportunities for you to be able to do that. And the problem is that we have not created those opportunities. And in fact, we have eroded those opportunities. And that's why we have so many people that are experiencing homelessness, because these are the folks that we have completely like basically walled off of our society, right? Because it's uncomfortable to watch someone who's homeless. It's uncomfortable to have to recognize that we failed them because they don't have access to mental health or substance treatment. And so what happens when somebody has lost all hope, right? And that's what we've done. We've removed the hope that you can actually advance in your life in whatever way you define that if you wanted to, right? And so I think that's the piece about why like the physical structure of a neighborhood, as you mentioned, Jose, like actually reflects how we feel about ourselves. And so the collective is our society's feeling like other people don't deserve investment. And so we got to change that narrative, right? And we got to get to a point where you and I believe, right? And I know we do, but everyone, right? We all should believe that human beings are worthy of investment, regardless of what station of life they're in, who they are, where they come from. If you believe that, then we should demonstrate that through our actions and we should demonstrate that through our investments. And that's where I think the piece that ultimately is the question. And that's what racism has done, right? Because what does racism do? It tells us that some people are worthy and others are not. And so you don't have to blatantly call yourself a racist, but if you adopt kind of the messaging that racist and racism puts out, that's how you integrate, that's how you adopt, right, kind of those feelings of inequity. And that's how you perpetuate in what we call systemic racism. You know, you don't have to call yourself a racist, but if you enable the system that is inherently racist to continue, then you're perpetuating racism.
Wow, I had mentioned another question I have, but I think you answered it and or addressed it as far as, you know, folks not recognizing systemic racism when they are not thriving. Actually, you know, they're surviving. um, I know we're getting close to the time you had, so I'll ask if you have any questions for me, or if you want to put a plug in for any programs or anything.
Yeah, no, I mean, I think that I'll do a plug-in in terms of I think that the only way that we can move forward is by building community, right? And I think building community is about being able to see the humanity in each other, and that you don't have to like have any specific set of skills to organize, that you just have to be willing to learn, because organizing is really about how do I learn with other people in my neighborhood or in my community. And you can define community however you want to define it, right? Because you can, I'm part of many communities, right? I'm part of Latina community, immigrant community, I'm part of women, I'm part of community, the Kawa community, Fresno, right? So all of us are not like just part of one community. You can be part of many communities. And that ultimately organizing is really about acknowledging that you don't know, and that you're willing to learn, and that you're willing to put in the time and the effort. And I think, you know, so I just want to demystify like what community organizing is, right? And that ultimately, I really do believe that the strength of organizing will enable us to change and transform our communities, right? And that's because our salvation and our success is not dependent on politicians. It's really dependent on our community. And so I think that I encourage folks to organize with their neighbors, with their family, with their friends, and really like advance the things that make you happy, that will make your community thrive, and that, you know, politicians come and go, but organizers, you know, we're in it for the long haul. And so if you've thought about being an organizer and you felt like maybe you didn't have it in you, that as long as you're able to build relationships and build trust and be genuine, like that's all that you need to be an organizer.
Awesome. I think if I said anything, I would just diminish your great message. And so, with that said, I'm really grateful for your time. I think, um, you know, everything you shared is really valuable information that a lot of people can get use of out of, or if not even use, maybe just validation for how they sense things are. Um, and so with that, I just say thank you, muchísimas gracias. And if you ever you know, need my support in any capacity, just feel free to reach out. And one thing I'm trying to do is also get folks across the state to like help others with their local events, to say, hey, we have the same issues in our community that they're going through there.
Yep.
And so we want to lend our voice from this city to say we see the pattern and we disagree as well. So with that said, thank you so much.
Thanks, Jose.
Have a good one.
You too.
Bye.